We're going to talk about Achilles tendonitis, and more accurately called Achilles tendanosis today, common disorders of the Achilles tendon. The Achilles tendon attaches down to the heel bone here. This is the main portion of the Achilles tendon. Then you've got the calf muscle with the gastrocnemius and soleus muscles up above, and they come down together to form the Achilles tendon. You can have Achilles tendonitis right in this portion, which is called the watershed region of the Achilles tendon, or you can have it where it attaches here. Symptoms of Achilles tendonitis can be just plain pain in this area, or you can have swelling and sometimes redness. Usually it's aggravated by activity, but not always. Causes of Achilles tendonitis range from overuse, mechanical foot types, injury. Those are some of the most common things. As far as the foot type, you can have a flat foot where there's more strain and more pulling on the calf muscle because the foot is so flat. But it's interesting that very commonly I see people that have Achilles tendonitis that have a high arch foot, and they're always walking on the outside of the foot. And so what happens is the Achilles tendon ends up, they're like walking on the outside of their foot, and the Achilles tendon attaches down here, so it rubs over the top of the back of the heel bone, which is the calcaneus. And so it's rubbing like this with people that have a very high arch foot. They walk on the outside of their foot. So that's one common cause, by far the most common cause that I see of Achilles tendonitis. But once you start getting inflammation, you can actually have additional changes with an Achilles tendon. You can have degeneration, you can have spurring, you can have calcification right down in here. So that on x-ray you're going to actually see a spur on the back of the heel bone right above this area. We might be able to get an image of that later. Now let's take a look at the Achilles tendon. So one of the most effective ways of looking at the Achilles tendon is to look at it with ultrasound imaging. And this is a high-resolution ultrasound imaging unit. And now we're looking at the back of the Achilles tendon here where it attaches at the heel bone. And so we're looking at it like this. And now let me move to the ultrasound screen. And this is what we're looking at here. We're looking at it like this. So here's the heel bone right here. Here's the Achilles tendon coming in here. All those little parallel fibers here. And then I'll show you in a minute where the attachment is here. Now we're switching back. So the Achilles is attaching way back down here. This is an area right in here where we can see calcification or spurs within the Achilles tendon. We can make that screen bigger. So these are the fibers of the Achilles tendon. This is the heel bone. And what happens with Achilles tendonitis is this tendon becomes physically thicker. And sometimes you can see little tears within the tendon or swelling within the tendon. Tendonitis, how do we treat it? If it's really bad, really swollen, hard to walk, then we have to rest it. And so a cast boot can help so that we're not straining the Achilles, because the whole foot and leg function as one, and the Achilles doesn't have to be strained, so that allows it to rest. Of course, icing it is helpful then. Anti-inflammatory medication can be helpful. Once that acute phase is done, then it can be helpful to stretch out the calf muscle. So calf stretching using a night splint can be helpful too. So when you're sleeping, your foot is stretched out. And once things are calmed down again, also, it's helpful to wear an orthotic. People that walk on the outside of their feet need a special orthotic that has a buildup on the outside and other components also, so that they're not walking so much on the outside of their foot. The orthotic will effectively support the outside and support the arch at the same time, and keep the whole foot from alternating from supinated or high arch to a lower arch position and grinding the back of the heel and the Achilles. So that's where the orthotic will help. The other thing that helps, though, is the Achilles train brace is a great brace. It's made just for Achilles tendonitis and Achilles tendonosis. It has a built-in heel lift, which is helpful. It has very large gel pads that cradle the Achilles tendon, and they will help keep it supported and also limit excessive motion. And if all else fails, in some severe cases, the damaged Achilles tendon has to have surgical repair. And that can vary from arthrocare, doing small little defects that are very finely calibrated within the Achilles tendon, to actually stripping off scar tissue of the Achilles tendon, to actually removing the Achilles tendon and reattaching it with anchors and removing the underlying spurs. So there's a whole variety of surgical techniques. And that concludes this talk on Achilles tendonitis.